increased stress that has been difficult to deal with, just kind of with regular meditative practices, deep breathing, gentle exercises such as yoga, which are things that I encourage all people to kind of develop their own practice for stress management and reduction.
So I refer some of my patients to massage therapy. I don't refer all of my patients to massage therapy. Generally speaking, I would refer a patient to massage therapy if they have done physical therapy and not had good results with that.
First of all, I'm a family physician, so I have the luxury of knowing people. Some people like to take pills, some people hate to take pills, some people believe very strongly in alternative therapies. So kind of knowing the values of the people is important to know kind of when in the list of different treatments, to insert massage.
It is really helpful to bring in the element of another practitioner who's skilled in touch, and I feel that touch with another human being can be extremely beneficial for stress reduction, as well as for anxiety, for depression, chronic headaches. Sometimes people will have completed courses of physical therapy for inflammatories, for arthritis, or musculoskeletal injuries, and they're still having a lot of chronic pain. Massage tends to be helpful in my experience for that as well.
Especially if they have myofascial pain, so a lot of muscle pain. Trigger points in particular tend to be amenable to massage therapy treatments. And oftentimes patients actually don't have insurance coverage for massage therapy, so I do try to consider their ability to pay for it as well.
I kind of consider having a tool belt, and we've got imaging, that can give us some information on anatomy and different problems, but it doesn't do anything towards treatment. And so people spend a lot of money getting to the bottom of what might be wrong or what's not wrong. And so a lot of times you have to run with this uncertainty because you have people complaining of things and you try everything you can think of. And the goal becomes not maybe so much to heal them, but to help them cope with their discomfort in the most productive, least toxic way. And for those kinds of people, massage therapy is a wonderful thing because there are relatively no side effects. So I send people to massage therapists when we've eliminated a lot of the dangerous things it could be, and it's an issue of coping. Also, to help heal after surgeries is another good time. You can get swelling and lymph and a number of things under control in ways that are very helpful to people as they recover.
Usually after 1 or 2 sessions, I hear positive feedback from patients, and it really depends on their specific circumstance as to how frequently they continue to follow up for that.
Mm-hmm.
But in general, the benefit does tend to occur fairly quickly.
Massage therapists?
I would say it's variable. A lot of my patients find that they get good relief that will last for a few weeks to a month, and then they need to have repeat sessions.
Mm-hmm.
When they're working with a good therapist, they look forward to their massages, and they find alleviation of chronic pain for different things that we've, as allopathic physicians don't have a whole lot to offer other than medicines to numb things. If it's plantar fasciitis, you can try physical therapy, you can try a number of different things, but you can't stop walking or working, and so you need something to help you get through your days in the least amount of pain.
The patients that I send to massage therapy are usually the ones that at least have been very compliant with their regular physical home exercise program and such, and also are not kind of overly fearful about their pain or worsening their pain instead.
Some people have a total fear of getting naked in front of other people and would be very uncomfortable to be touched sometimes. And just kind of knowing who you're dealing with helps a lot.
That some of our patients are very fearful about, you know, any increase in pain, and you know that fear and kind of expectation that, you know, whatever we do is, you know, always going to be kind of pain free. Doesn't really kind of bode well when they kind of if they're trying to massage the muscles, and then it hurts even more. So if they're fearful about pain, I don't send those patients to massage therapy.
Whoever is helping, the people that you're also helping, whether it's a social worker, a physical therapist, occupational therapist, counselor, massage therapist, pharmacist, you know, the flow of information. Again, you know, I'm speaking from a primary care perspective. It's through me. I'm the clearinghouse place where, you know, I should be able to give you information about all kinds of aspects of people's lives, historically and in, you know, current day.
Sure.
More of a complementary and alternative treatment, I would say.
Mm-hmm.
I guess our team I consider as being the people who are here in the hospital with us.
Sure.
It's another relationship. You know, a lot of, I think, what we do, at least in primary care medicine, is giving people a place to vent, you know, a place to kind of leave some of their cares. And when you're sharing that between a number of professionals, it can be extremely helpful.
I do. So I think that team-centered care is a very important part of primary care. So the patient-centered medical home, which is a new concept that has really become important in primary care over the last 10 years, is something that has been pushing primary care physicians and practices more toward a collaborative team effort in the care of every patient, and it has been shown to increase you know, beneficial outcomes for many different conditions, especially chronic conditions like pain and high blood pressure and diabetes.
Right.
They've all been shown to be best managed with a team approach.
Kinds of things, you know, there's things that massage therapists can find, like skin lesions or you know, atrophy of a muscle group, and that can lead you to other diagnoses. And
A massage therapist who is trained in musculoskeletal disorders or more familiar with anatomy and the benefits of physical manipulation, you know, it provides an element of you know, knowledge base that many primary care doctors just don't have, and it really adds that extra dimension that can be helpful. So, you know, I think that it's important to continue to try to learn as much as you can, and I encourage students to not stop at the knowledge that you were given in medical school, but always keep searching for you know, the newest evidence and the newest knowledge, as well as looking to the old, which can also give us a lot of depth and dimension to our medical practice and care of patients.
I think it's great that they're going to be learning the surface anatomy better. That's a really important part of being able to do an evaluation and examination of a patient. The students will discover that if they do primary care, a large majority of their patients will be coming in with musculoskeletal problems, and so they need to be able to assess those, and this will be a good start for them.
I actually am so excited that you guys are doing this. I wish that there had been something like this available to me when I went through training so many years ago. The potential benefits just from having a physical sense of what muscles feel like when they're alive. It's so different than the cadavers.
Right now, I don't think, at least most of the docs don't kind of consider the massage therapist as part of the interprofessional healthcare team, but I do think that, you know, projects like yours, if, you know, the medical students have good experiences and they really kind of learn a lot more and a lot kind of in a different manner, and they keep that knowledge, then at least for them, they probably are more likely to, you know, consider massage therapists as part of their team. The healthcare team's probably
Right.
going to change a lot, you know, in the next few years and stuff too. So, and so projects like this can be very helpful.
An ability to refer correctly to people, to different kinds of referral sources is going to be, it's going to be huge. It's going to be very beneficial to people, and getting that sense, especially now with the patient-centered medical home and some of the changes that are coming in the actual practice of medicine, a team approach is going to be absolutely mandatory. And so the broader you can reach for your different helpers in taking care of people, and the more comfortable you are with that is going to be huge. So I think that in that way, this is going to be a very helpful project.